Imagine you were just diagnosed with an inoperable and incurable tumor, and your doctor tells you because of that tumor you only have 6 more months to live. The doctor doesn't tell you in that moment, though, that you will be restricted to complete bed rest in the hospital because of the excruciating pain you will be going through during that time. In this scenario, what would you do, and do you know all of your options? In November of 2014, a 29-year-old woman named Brittany Maynard was 11 months into unbearable pain and suffering from a malignant stage 4 brain tumor. She had weighed her options during that time, and after speaking with doctors about her options, she had chosen death with dignity, also known as physician-assisted suicide in Oregon, because that was the best option for her situation. Today I'm going to persuade you that being able to choose euthanasia and/or physician-assisted suicide should be a right that every person has, not something dictated solely by the state government. The definition of euthanasia is the killing of patients who are suffering from an incurable and unbearably painful disease or are in an irreversible coma. There are also 3 different types of euthanasia. Non-voluntary is conducted when the patient is unavailable to consent, involuntary is conducted against the will of the patient, and voluntary is conducted with the patient's consent. Non-voluntary and involuntary are illegal in every country and around the world, and is considered to be murder. However, voluntary euthanasia is legal in some states and countries. Euthanasia and/or physician-assisted suicide is only legal in 9 out of the 50 states as of 2019. According to procon.org, the current countries who have legalized euthanasia are Belgium, Colombia, India, Ireland, Mexico, and the Netherlands, and the current states who have legalized physician-assisted suicide are Oregon, Washington, Montana, Vermont, California, Washington, D.C., Colorado, Hawaii, New Jersey, and Maine. There is a very slight difference between euthanasia and physician-assisted suicide, which is that euthanasia is done by a physician, whereas physician-assisted suicide requires the patient to self-administer the medicine. As citizens of the United States of America, we have a voice and should be able to choose whether we want to use this option instead of being limited by the state. You never know what may happen in the future that will leave you in excruciating pain with absolutely no quality of life. Thus, euthanasia and/or physician-assisted suicide should be considered legal everywhere and not dependent on the government agreeing or disagreeing with our requests. Now, I completely recognize the other side of this argument, with people believing that if it is legalized everywhere, then people will take advantage of the option and could lead to them going down a very slippery slope. That slippery slope is a fine line that could be a debate between voluntary euthanasia and involuntary euthanasia, which means it can go from a choice to murder very quickly. In the journal Physician-Assisted Suicide and Euthanasia, Safeguarding Against the Slippery Slope, the Netherlands versus the United States, it states, the principal argument against physician-assisted suicide and euthanasia is the slippery slope argument. Opponents contend that the legalization will lead to cataclysmic events resulting in the arbitrary termination of vulnerable groups of people. I agree with that statement because I know that if vulnerable groups, such as the elderly or depressed individuals, are not evaluated correctly before given this option, it may possibly lead to a very high increase in death rates. Another argument that can be made against this topic comes from the journal Contemporary Debates in Applied Ethics, a case against euthanasia, which states to give physicians the power to kill patients or assist in their suicide when their actions are clothed in confidentiality is to run a considerable risk, one hard to spot and one hard to act upon. I believe the risk being talked about in that quote again relates to the vulnerable groups in the world today, where doctor-patient confidentiality can mask the issue and claim it was only a physician-assisted suicide based off an incurable disease when there's absolutely no disease involved. While the arguments stated are completely valid and understandable, there are certain cases in the world today where these options are better for people and make their voice and opinions be heard. For Brittany Maynard, physician-assisted suicide was the option she had chosen after being diagnosed with a stage 4 malignant brain tumor on New Year's Day and being told in April of that year she only had 6 more months to live. According to the Washington Post, the article written about her decision gives you a little insight into how she came to this decision. One part of the article states the exact reason why I believe people should be able to choose physician-assisted suicide. The article states, near the end, Maynard's symptoms worsened. She suffered frequent seizures, head and neck pain, and stroke-like symptoms, said Sean Crawley, a spokesman for Compassion and Choices, a nonprofit organization that supports death with dignity laws for the terminally ill. Brittany Maynard was already dealing with enough pain and after being diagnosed with an incurable brain tumor, and now also adding these symptoms on top of everything, I assume this caused even more pain for her and her loved ones that had to watch all of this happen to her. The article also says, but as symptoms grew more severe, she chose to abbreviate the dying process by taking the aid in dying medication she had received months ago. This choice is authorized under the Oregon Death with Dignity Act. Brittany had made this decision because in her situation, with all the excruciating pain and suffering she was going through, this was the best option for her to not suffer anymore. As of September 11th, 2000, cancer patients comprised the largest group to die by methods of euthanasia or physician-assisted suicide. In the journal, Attitudes of Terminally Ill Patients Toward Euthanasia and Physician-Assisted Suicide, it states many patients with advanced cancer favor policies that would allow them access to both euthanasia and physician-assisted suicide if pain and physical symptoms became intolerable. For patients battling against cancer and having to go through the everyday pain and suffering, being given the option to choose what is best fitted for them should be their choice and not a request that is granted or denied by the state government. As someone who has had a family member that battled 3 different types of cancer, I would have wanted that family member to have chosen what is best for them. While the decision may seem very morbid and a way out of the disease, no one will ever know what it is like to be in that situation until one day they come face to face with the choice between life, pain, and suffering, or death with dignity and no more suffering. Every person should be able to make their own decision and an option to choose euthanasia and or physician-assisted suicide and have it been completely legal. I have now given you the background information you need for this topic to help you understand and be more informed on the issue at hand to make your own opinions. I have also explained why I believe euthanasia and physician-assisted suicide should be legal everywhere. And lastly, I have also explained solutions to the valid fears people express about the legalization of euthanasia and or physician-assisted suicide. Thank you for listening, and I hope this gives you a greater insight into what happens around the world today.